Well, hello. I am here with two wonderful women, Dr. Carol Penn and Dr. Kathy Farah, who are two of our gracious speakers who will be talking at the 2021 Integrative Education Symposium on February 26th and 27th. Dr. Carol and Dr. Kathy will be presenting their course, Disrupting Generational and Racialized Trauma, What You Bring to the Table Matters. So we're here to talk to both of them and find out a little bit more about their background and talk a little bit more about the course. So welcome to you both. Thank you so much for being here with me today. I appreciate it.
Thank you.
Thank you.
I would love it if you both would talk a little bit about your background and how you became interested in this topic.
Well, Dr. Kathy, would you like to go first?
I'll let you.
Thank you. Well, I'm Dr. Carol Penn, and I'm doubly board certified in family medicine and obesity medicine. And I'm also a master movement meditation and mindset coach, two-time best-selling author. So proud of my book, Baby, Meditation in a Time of Madness. And oh my goodness, faculty with the Center for Mind-Body Medicine, which is how I met Dr. Kathy, and that's a part of this story, as well as faculty for Rowan University School of Osteopathic Medicine. So how did I get interested in this topic? Well, I think I was born interested in this topic. My parents were both civil rights activists, so I grew up with this idea that it was important to be a part of the whole, that it was important to have rights, that it was important to vote, that it was important to be seen fully as human, and it was important to be able to live up to one's potential and get to have a say in how you lived your life and expressed your life. So I really don't have any conscious memories of not being interested in this topic. I was, raised to be interested in this topic as a matter of survival.
Thank you, Carol. So I'm Dr. Kathy Farah, and I'm an integrative and holistic family physician. So I'm board certified in family medicine and in holistic medicine. And I became interested in this topic a couple times actually through my life, but being a person that looks like me, being a white American, I realized that there's a lot of times I haven't had to be interested into this topic. And there's been situations in which I've noticed that my friends of color have been treated much differently, including Dr. Carol, as we have traveled together and gone to conferences together and such. And so that's led to some really deep conversations, some conversations that you can have when you're really a friend who wants to be a truth teller. And certainly as modern era has evolved, and I've just been increasingly aware of our disparities, our inequities, I have been on a journey to learn more, but not just to learn more, but to share more. And Dr. Carol has been very gracious in helping me on that journey. So I think there's a lot to share, and I think that really what we do bring to the table, or our room, our exam room, or just our interaction, my background versus Dr. Carol's or yours, Heather's, really does make a difference. And that's why we really are committed to not only learning, but also sharing, making it an action step.
Yes, and I think we are committed to diversity on multiple levels. So there's not just, the optic, skin tone and hair texture and facial features, which, that is an optic, but also diversity in thought. And I think for me, it's been my experience that, the conversations only go so deep, and then people want to retreat into being polite because we don't want to hurt each other's feelings. And I know for me, I had gotten to a place in my life where I wanted friendships where I could be fully myself, where I could say the thing that might otherwise, we tend to shy away from. So if you're truly my friend and I'm truly your friend, we ought to be able to express in a conscious way and in a loving way what is true for ourselves. And I think that working in the context the way we work with the Center for Mind Body Medicine provided a natural backdrop for that kind of risk taking. And at some points in Kathy and I taking risk with each other, it kind of dawned on us that maybe other people out there need to know how to take a risk, or maybe they want to take a risk, because the conversation, I know for me, always would stall at a certain place. Always, and then you just don't say it. And for me, oftentimes being the first person of color or the first Black person with an organization or in a room or doing a project, and then often not only being the first but being the only, you find yourself stifled. Well, if I really say what I'm thinking right now, I won't be invited back to the table anymore. And I decided that I had lived long enough in this body as an African-American woman that I wanted to take some risk. And I wanted to have friendships go beyond the superficial with people who don't look like me.
I know in your course, you're going to be bringing in a lot of your training from the Center for Mind Body Medicine, and you're going to be inviting some of those conversations and creating a safe place for that. I'm hoping that you can talk a little bit more about what else to expect with the course over the 2 days. It is a 2-day course, both Friday and Saturday. So if you could talk a little bit more about what to expect, that would be great.
Sure, I'll go ahead and start if that's okay with you, Carol. I think what we have found is that what we can do, and what seems to be particularly effective, is to start really partly by identifying, where do our biases come from? So, for example, we look at personal history and family history and interactions that we've had, looking at the way that we do. And I believe that we, by bringing in mind, body, spirit techniques, we're able to balance our nervous system, because sometimes you can even feel your heart racing, or for heaven's sakes, feeling shame and, gazing at the navel essentially, and being in inaction, being frozen. And I feel like by really incorporating ways to balance the nervous system as we uncover truths and move forward is a particularly effective framework for learning. And because it's not just head learning, it's learning in the body, and it's healing in the body. So we really balance a lot of that.
Yes, and I do think that's what makes the course different. Oftentimes, these are difficult conversations. And if you care about the person or the group that you're with, you don't want to say the hurtful thing. But so much of our history and so much of what has occurred, it is hurtful. It's hard to say it. It's hard to hear it. It's hard to say you've been perhaps victimized by any of it. And I feel that victimization is a two-way street. And so this is an opportunity for people who are ready to be open in this way to move beyond that, to move beyond those taboo places, those frightening places, those like, oh, that feels really dangerous over there. And, you can feel it in your body. You start to tense. And we have all kinds of things. We have $1 billion industry in mysterious low back pain. And nobody can ever find any diagnostic proof for why this person has this extraordinary low back pain. When you look at some wisdom traditions, for example, like yoga, in yoga, they refer to that area of pain that most people complain about as the psychic knot. Meaning that this is the place in our body that a lot of unresolved trauma goes to, a lot of what we're not able to speak goes to, and it goes, into the lumbar region of the spine. And this wisdom tradition has a whole school of thought around that explains that, and we don't have that in our Western tradition. And so some of the things that we bring forward through our work with the Center for Mind Body Medicine and with the course that we're offering in February for the symposium brings this in. Because you're never going to see the psychic knot on the x-ray. It's not available. It's not available on an MRI. You know, how many billions of our third-party payer insurance dollars are spent chasing down a diagnosis that doesn't exist in the Western tradition. And so we help people explore that. We incorporate movement, we incorporate breath work, we incorporate journaling, even the way we roll out the genogram in such a way that people will explore mind, body, and spirit. And we make it available in a way that is not accessible, I have found, in other programs and other courses.
Yeah, I think the format, I'm really excited about the format where you're going to be using small group, large group, experiential. I'm hoping you can talk a little bit more about who this course might be for, if they're kind of looking at the different offerings, or if they're kind of looking at the description and thinking like, is this course for me? Could you touch on that a little bit more?
Dr. Kathy, any thoughts?
Yeah, well, of course, I want to say it's for everybody. But in particular, those of us who are, you know, it's not that we're bad people. You know, we're nice people, but sometimes being nice isn't enough. And you may find yourself just sort of niggling like, oh, you know, I could be doing more. I could be learning more. And how do I move this action, about racism, for example, implicit bias? You know, where am I really bringing that in without even knowing it, unconsciously? And I think anybody that has even an ounce of curiosity about that, I think would be a great participant in this course. And in particular, really knowing that, and, you know, a lot of us are doing a lot of reading, and I think it really helps put it into an action step. Mm-hmm. Carol, you want to add to that?
Yeah, and I was also going to say, well, if you're human, it's probably a course for you. So if you consider yourself a part of the human race, then it's certainly worth exploring. If you are a person who is concerned that there are so many people in the world who are hurting, some that look like you, many who do not look like you, this is a course worthy of your exploration from whatever ethnic group that you might come from. If you look into your own family history and you see any sort of pattern of pain or shame, or why did your family come here in the first place? You know, were they leaving their native land because of some persecution? You know, so, you know, any part of the human story, anywhere you plug in, would be a reason for you to be in this course. And if you are in healthcare, it is critical at this time that you come into this course and that you're willing to examine your biases, some of which you might not even know that you have or that you exhibit. Yet study after study, if you're a data-driven person, study after study after study after study keeps pointing this out. There is something horribly gone wrong in healthcare with the level and extent of healthcare disparity that, and it's not just like it's causing a little harm. You know, you don't get to take the Tylenol, but it's costing people their lives. You know, so if you are a healthcare professional, and if you want to treat the human beings that you treat to the highest of standards, to the place of reciprocity, of understanding fully what it means to be human, then you want to explore this course or courses like this.
I know for the folks that have attended our past symposia and some of our other offerings, you know, understanding and thinking about care from a trauma-informed lens, to me, this was another layer of that, with understanding the racialized trauma and the generational trauma. I'm wondering if you could talk a little bit. And so when I was thinking about our next offering, this seemed like another building block on some of the things we've offered before. I'm wondering if you could talk a little bit more about, if folks have had some of that trauma-informed training, maybe with us or, you know, with different organizations or folks, how does this connect and build off of some of that prior knowledge?
Well, I think again the sort of the neurobiological piece that we built in, and that's also can be explored in other trauma informed courses. But the fact that we do look at it through the lens of racialized trauma, that's the big problem. That's the elephant in the room. Is that we keep not wanting to look that squarely in the eye. And that is, we're going to talk about that. The United States, we are a nation of immigrants. Even if you go back to the 15 million indigenous peoples that once inhabited this land prior to colonization, prior to the Middle Passage and the slave trade, they too migrated across landmass when the continents were all one. They came across those Bering Straits. So even they are immigrants. So we are a nation of immigrants, bar none. And then over time, the artificial construct of race was created to stratify people for economic advantage. And we're still operating out of that system. So it is a hard truth and a hard history that we need to examine, and none of us can escape it, and we certainly aren't going to change it doing the things that we have been doing in the past. So that's the additional piece. So yes, there are trauma-informed courses, and unless those trauma-informed courses are head-on addressing this racialized trauma, they're missing a big part of it, because that's the big problem in this country right now, and globally. Unfortunately, we're seeing this proliferate around the globe, but we're here in the United States, so I'm going to focus on what's going on here in the United States.
Yeah, and to add on to that, I mean, I've had the good fortune of attending Kim Barthel's course last year in person. It was just about the last in-person conference before our wonderful COVID hit. And like I said to Carol, we've got big shoes to fill. I mean, she does a wonderful job of addressing trauma on a lot of levels, including race to a certain extent. But this really, as Carol says, brings it to the forefront. Let's just call it what it is. And this is really part of what we need to address. Well, something else that keeps coming to my mind, if you don't mind, I'm going to share this too. One thing I've found since I've been doing really more intentional anti-racism work, and even to, claim that work as anti-racism, I've really been really aware of ways in which I interact with people and how that might be different. So particularly in the clinic that I work at Children's in Minneapolis, which is, of course, very, very near the site of the George Floyd murder. And I really found, as I was working with kids virtually, after that, I just became really aware and was more likely to say to a family, for example, of color, I'm aware that, you don't live that far away. How's this going for your son? And he's like, he's so anxious, not sleeping. I mean, hearing that still over and over again. And it really, I don't know if I would have asked that question 2 years ago. I'm not sure if I would have, or if I would have been afraid to ask the question. Mm-hmm. And I just find that I'm much able to, I don't want to be in a respectful way, but really ask sort of, again, the obvious. He's happy to be at virtual school because he's not getting bullied, or whatever that might be. So I just really wanted to share how I have found doing this work and teaching this work and always learning more has impacted the way that I practice.
Yeah, and I think that's the invitation. So, many of the people who will be attending are obviously in healthcare professionals and in allied health and what have you. And our avatars are other human beings, and to bring this awareness into the room with you, because you're not in the room with a white person or a black person or a red person. You're in the room with a multifaceted human being who has a lived experience. And I feel that in being a medical professional, which I love so much because I love intimacy, and we truly have the opportunity to be intimate with other human beings that is not available in other professions. I need to be curious about you. I need to understand the derivation of your last name and your grandmother's journey and what her lived experience was like, because how I treat you and the recommendations that I make to you should be based on the context of your lived experience. And so, yes, there is that one obvious layer, but you're much more than that. You're much more than that. So I might be treating hypertension, for example, in both of you, but when I learn the history and the story of Kathy's parents and grandparents, and when I learn the history and the story of Heather's parents and grandparents, I might make slightly different or even radically different recommendations based on understanding your medical and historical narrative. And, those are the kind of medical professionals that I want to see when I need to go see someone for my own treatment and for optimizing my own health and well-being. And these are the kinds of medical professionals that I want to be involved in training and cultivating and educating and saying you are fit to treat another human being.
Yeah, this just makes me really excited for the learning opportunity with the therapists that are going to, and allied professionals or educators that are going to take this course, because that's one thing as occupational therapists that we do is we talk about that family history, the developmental history. We look at their home environment, we look at the family dynamic, and this is such a big piece that some folks aren't directly saying, like you said, Kathy, like, tell me about tell me about how this is going and how you're feeling about what's happening in the world. And so I think this is such a wonderful invitation for folks to explore this piece and talk about it directly and think about how they can approach their families and the children that they serve in a human way and in a connective way, and really being more effective at serving the family. So I'm thrilled about this course. I'm thrilled that the two of you are teaching it. Before we sign off, I do want to kind of do a fun question to get to know both of you a little bit more. This is the time of COVID where we are watching a little bit more TV. Do you have any TV shows or movies that you have been enjoying during this time and kind of, escaping and a little bit of self-care for yourself?
I have to say, since I just recently saw it, by all means, please see Pixar's Soul, Soul. It is fantastic. And of course I love it. It's talking, what's not to love? They're talking about meditation. They're talking about self-care. They're talking about purpose in life. So, it's like, right up my alley and in my sweet spot, so to speak. And the art of the way the film is animated. So you can watch it from several levels. If you just enjoy artistry and the way the animation, the artist, it's just absolutely stellar. If you like the quality of a voiceover, and again, that's something that, you would resonate with, you could probably not watch the film, although it is visually compelling, and just listen to Jamie Foxx and Angela Bassett and Tina Fey. Oh my word. Their characterizations are so strong. You don't necessarily need the optic of it, and it's just, and the music in the film, and Angela Bassett as a woman who's leading her own band, which that's still kind of unusual, but certainly the era that she's depicting. So lots of messages in there. Lots, and I loved it. I'm going to have to watch it again. It was just really artistically, and the production values, Oscar level artistry, I would say, for this film.
Wow, I don't know if I can beat that. So I don't watch that much TV, but I watched the whole season of The Voice. It was just fun watching, people get up there and, sing their hearts out and just see what they brought to it. So I just really enjoyed that.
And don't you love the life stories?
Yes,
when they bring that out in the voice? Oh, like there's that human element again. And you get so drawn into, this person, who lives in a town, 10 people and no running water, and they sing like a choir of angels type of thing. But yeah, I too love that kind of reality television where they take you behind the scenes into the person's life.
And I like the fact when they do the blind auditions that they hear the voice and they don't see the person. Right. And they're voting purely on their voice. That's the part I really like. And then they turn around like, and I think that's really what happens. I mean, in a way, it plays into like our course, what judgments do I make just by what I see without even knowing it? Right?
Right. And the judges will say that. They'll go, oh, you don't look like what I thought you were going to look like. Like, oh, that voice, sometimes like it's a 10-year-old who's singing, and they go, what? That sound came out of you? And it surprises them. And we make assumptions all the time as human beings that are completely wrong. Mm-hmm. So, yeah. I'm a fan of the voice.
I'm excited to watch Soul, and I need to revisit The Voice. It's been a long time since I've watched it. So great recommendations. We hope you join us in February 26th and 27th at the Integrative Education Symposium. Again, their course is Course A, Disrupting Generational and Racialized Trauma. What you bring to the table matters. Thank you both so much. So grateful for your time today, and we hope that you join us in February. Thank you, ladies.
Thank you, Heather.
Thank you
for the opportunity.